Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in downsizing and seniors residences.
I'm Matt Delvecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corrie Matt, a clinical social worker and psychotherapist and author of Someone Died, Now What?
And I think you were just imagining you and John Travolta dancing away there, Corrie. There is a song we haven't heard in a while, but probably appropriate, Night Fever. We're going to be talking to some pharmacist questions with Nada coming up shortly. But I have to ask you, Corrie, first night of terraces being allowed, did you venture out?
And that would be a big no. Not because I was scared, just because I was probably lazy. What about you?
I actually did go out with a couple of buddies and we grabbed a pint together. And I have to say it was a bit surreal. You know, it was just great. It was well done where we were, properly distanced, and just you almost forget about it. But just being with everyone, it was fantastic. And I think this is just going to really lighten up the moods for many Montrealers.
Sure. Good for you.
All right.
So, right into this, I just thinking the fever, I was like, night fever. Oh, I get it. Really very clever. Okay. We're actually very excited. I have been looking forward to this interview because I know the power of the pharmacists and their knowledge is unbelievable. So we are really pleased to have Nada Nasreddine, who is a pharmacist. She graduated from the Université de Montréal in 1990. Nada is a pharmacist owner of Pharmaprix, Beaconsfield, and Kirkland. She's also very much involved in a wonderful nonprofit organization called West Island Community Shares. She's been involved in that since 1999, including 5 years as their president of the board of directors. Nada is also a mother of a beautiful 15-year-old daughter. Nada, that's busy. Welcome to Life Unrehearsed.
Hi, hello, how are you?
So glad to have you here. I'm going to go right into the questions. So, it's my understanding, there's been a couple of laws that have been put in place over the past few years that have given greater autonomy to pharmacists, which I think has been a real benefit to all of us. Can you provide us with some of the examples of your greater responsibilities?
Yes, of course. You know, I'm very excited about these new laws because as a pharmacist, we can play a bigger role in helping many more people. Our new scope of practice can help the physicians and ourselves by working together in many situations. So pharmacists now can re-prescribe certain medication, and I say re-prescribe meaning we need a diagnostic from a doctor before, within the 2 to 5 years in certain conditions. One of them is the urinary tract infection in women. I say women not to be sexist, it's because the urinary tract infection in men are more complicated. So we can re-prescribe an antibiotic in that condition because the patient knows their symptoms and they already had something prescribed. Other situation that we can re-prescribe also is in cold sores, canker sores, some allergies. Now as allergy season is here, so there's so we can re-prescribe certain prescription medication that are not over the counter and many other things. And also, which is also newer, we don't, in certain situations, we don't need a diagnostic to prescribe. And these are, for example, smoking cessation, emergency contraception, or short-term hormonal contraception. When we can start traveling soon, hopefully, again,
That's right.
A pharmacist can prescribe medication for preventing malaria, travel diarrhea, and also, which is new, vaccines. One thing that I find extremely interesting is prescribing for a condition shingles. For example, this is very important. A patient can see like an eruption on their skin, and if it's assessed within the 72 hours, the treatment, the antiviral, will start working much better. And so we can start the treatment, and the patient has to go see the doctor within the 3 days to confirm the diagnostic. This can be also done in the case of influenza. So we can start an antiviral, and the patient must see a doctor within the 48 hours. Lastly, and actually the list is so long, so we can maybe spend an hour, but I'll say one or two more things. The Lyme disease prevention. So if a patient or notices a tick stuck to them for more than 24 hours, and then they have been in certain regions where the infection can be transmitted, they can come to the pharmacy, and the pharmacist can prescribe now an antibiotic to help preventing the Lyme disease. What else can I tell you?
Well, I was going to just say, Nada, it's amazing to hear all this, and there are more, and it's wonderful to hear because even just from a few years ago, a lot of these things you weren't able to do as pharmacists. And I also find that it seems to be increasingly difficult to get answer from GPs. They're busy. Many families don't even have GPs, or individuals don't have GPs, and it seems, I know personally for myself, I seem to be going to the pharmacist more than the GP for consultations because I'm getting answers quicker and good answers. So are you seeing that you're just getting more and more inquiries from the general public about general consultations?
Yes, Matt, we are getting much more. And then one of the reasons why the College of Physicians and the Order of Pharmacists gave more power to pharmacists to do more is to help the physicians to do what they do best, which is diagnostic and use their unique expertise to provide valuable care and everything. So the pharmacists, by being able to help in many much more situations, we can ask, like, if a patient comes to us and the situation needs to be dealt by a doctor, we will definitely refer them to a doctor right away or to the emergency. And if it doesn't, we will help them. Yes, we are seeing an increasing amount of people come to the pharmacy, and it's a help for the doctors and the other health professionals for the patient care.
That's Nada Nasreddine. She's a pharmacist, and she's talking to us and enlightening us on Life on Rehearse. I'm Corrie Sirota with my co-host Matt Del Vecchio. And I think that this is a whole new area to look at and understand. So I had prepared some questions, and I'm looking at the question, and I love this question. I can't wait to get, we sit and we get prescriptions filled, and it's frustrating. We have no patience whatsoever to listen to to wait. And I think it would be helpful for us to understand that what goes into making a prescription.
That's a very good, nice question. Thank you. It's actually, when you look from the outside, people sometimes do ask us, my God, it doesn't seem busy, or what are you doing? What's going on? And actually, there's a lot going on behind that counter. When we get a prescription, we have to make sure that we to ensure the appropriate use of the medication. We have to make sure that it's not one dose fits all, not one strength of a medication fits all. Each patient is different. Some people, we need to assess if their kidney function by checking their results on the, I'm not going to go into much detail, but we have to make sure that is the right dose for them. And then sometimes we get hospital exits that we have to check, is everything that was the patient went in with certain kind of medication, they came out with different kind. Is there something that has been forgotten or so there is a lot that goes on. There is a phone consultation. There is so many things that goes on behind that counter. So we try to use technology and to help us in that aspect. Meaning, if a patient renews their medication in advance the day before, or gives it, so we can deal with the situation that need to be dealt with right away.
Absolutely. And we're going to talk a little bit more about that technology because it has made it a lot more efficient. And Nada, we have to head out to traffic, but we absolutely want to address the vaccination issue. And vaccinations at pharmacies have become an integral part of the whole provincial vaccination campaign. And we'd be interested to hear how you have had to adapt your pharmacies for that. But first, we're going to head to the CJD Traffic Center for a traffic update.
Life Unrehearsed, brought to you by Flora-Lee Senior Residences. Always there for you. Safe, reassuring, and comforting. We call it home.
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Matt, along with my co-host Matt Delvecchio, and we're talking to our new friend, the pharmacist owner, Nada Nasreddine, about the increasing role of pharmacists in our lives. Nada, this rollout of the vaccine at the pharmacies, it's huge. I suspect it's become an integral part of the entire vaccine campaign. So how have you had to adapt your pharmacies to be able to provide vaccinations?
Definitely. It has been a very big part of our day-to-day. And to adapt ourselves, actually, first of all, our pharmacists who wanted to vaccinate must take 4 courses, and one specifically on COVID, to learn on how to vaccinate, first of all, and about the vaccines, and to learn about Click Santé and everything else. So how we needed to adapt is basically... we have the consultation area. I vaccinate myself, and I have in each of my stores a nurse that also helps with the vaccination. So basically, our vaccination has to still go through Click Santé. Pharmacies received the Moderna vaccine only. Some of them got the AstraZeneca, no Pfizer, which I would have loved to have Pfizer, not because it's better than the Moderna, it's just because the supply of Moderna is erratic. So I believe that we could have done more vaccinations in the pharmacy level, but what we did was super new in my practice. After so many years of being a pharmacist, that we help in that campaign on vaccinating everyone, and it's actually a very rewarding feeling to be able to help and to have to see the patients. Everybody really appreciated the fact to come to the pharmacy. Also, they felt there's less people, more secure. Certain people prefer to come to us instead of different centers. But so this was my experience in that. So
yeah, and Nada, you and your team did a fantastic job. I can't imagine how you and pharmacists right across Quebec have had to adapt something that wasn't even on the radar perhaps a year ago. So congratulations to you and your team. As you mentioned, there's increased personnel, there's increased costs, there's increased stress and time. However, technology has played a very important role for pharmacists and consumers over the last few years. Can you address some of those technology benefits?
Well, technology, yes, we have lots of things for the consumers. Let's say what we're talking about previously, instead of coming and waiting in the pharmacy, so the internet refills, the pre-authorized refills can be done. And now the patient can send a picture of their prescription to their pharmacist on pharmafree.ca service, and we can get it and prepare it in advance. We have the automation at the pharmacy level, which is robots that help us prepare medication. We have the blister packs. There's a lot of technology that for us to ensure this greater demand on the pharmacists and the pharmacies.
Nana, could you just expand a little bit on the blister packs? In my world and senior living, and many seniors use these blister packs and dispill packs and so on. Can you just briefly explain what that is?
Well, the digital packs are a system that we as pharmacists prepare the medication for the dosage of the morning, afternoon, supper, bedtime. And then we make sure that some certain medication that can interact with each other are not put in the same time of the day. And so this facilitates for the patient the how to take their medication. And sometimes, especially with the elderly, when there's a lot more than one medication they take, sometimes it's going to up to 15 different kinds. So, and then so that helps them. We have the date on them, the time, what to take, and you ensure that they're taking it properly.
That's pharmacist Nada Nasreddine, who is talking about the increasing role of pharmacists in our lives. we talked a little bit about already, but this is Life on Rehearse with Matt Delvecchio and myself, Corrie Sirota, and we talked a little bit about the pandemic and getting the vaccines. I also wanted to explore the fact that we all know the pandemic has disrupted many of our lives in a host of ways, and pharmacists no exception. So what are some of the examples of how the whole pandemic has affected pharmacies?
Definitely it did disrupt many of our lives, and then especially in the beginning, and then we had to increase a lot of our sanitary protocols. So that was number one. We have to increase our deliveries. Our deliveries doubled, if even tripled. I had one person doing my deliveries for the two pharmacies, and now I have two different people for each pharmacy, because the demand has totally increased. People did not want to go out to the pharmacy in the beginning to get their medication. We also, there's another thing that Coumadin it's a medication that needs adjustment, right. And people did not want to go to the CLSC or the clinic to do the adjustment to make sure that their blood is not too thin and not too coagulated. So basically, and I have a funny story is that, and then this patient didn't want to come into even the pharmacy, and that he needed to do his blood test. And we're like, okay, so basically I see myself with the Lysol in one pocket and my machine to do the testing, going outside in the parking lot. And, the guy gives me his hand, and we do the test in the car. And I think the COVID center copied me, because now there's a drive-through.
Good for you. God bless you for doing that.
Amazing, and just listening to you about the deliveries, it makes so much sense. Things we don't think about, but obviously deliveries are a huge factor. Again, you're providing this service at additional costs, and it's such an integral part of servicing the community. Nada, we're running out of time. We have time for one quick question, and just want to go back to the vaccinations. Who can go to a pharmacy to get vaccinated?
Well, at this point, anybody who is over 18 years old can go and get vaccinated, because we have the Moderna vaccine, as I said. And if we had the Pfizer, anybody is, eligible to get vaccinated.
Right. So they would still have to go to Click Santé and then choose their pharmacist that's near them, and they book it through Click Santé.
Exactly. Everything is done through Click Santé. Pharmacies, when we get our doses, we open up spots, and the patient just goes in. If a patient cannot access Click Santé by their computer, there is a phone number they can call, and by putting their postal code, they can see exactly the pharmacy or the center that is near them, and they book their appointment, and that's it.
Okay, great. Nada Nasreddine, pharmacist owner at PharmaPre in Beaconsfield and Kirkland. How can our listeners reach you, Nada?
Well, my pharmacies, I have two pharmacies, one in PharmaPre in Beaconsfield, the shopping center, and the other one in Kirkland, both on St. Charles. So any question you need, I'm available, and my staff is here.
Right, and great staff at that, and they could respond to your questions. Thank you so much, Nada.
Thank you so much.
Right,
have a great day.
You too. That's Nada Nasreddine, pharmacist owner of PharmaPre in Beaconsfield and Kirkland. Corrie, what do we have coming up next week?
Well, we're going to hear about something very near and dear to my heart, the Myra's Kids Foundation and our upcoming bereavement camp. And we're also going to hear from a leader and an entrepreneur in the eyewear industry. Susie Sindel is setting the market on fire with some of her fashionable frame collections.
Yeah, and some incredible frame collections. Looking forward to hearing about Myra's Kids Foundation and, of course, Susie and her frame collections. Thank you for tuning into Life on Rehearsed. As a reminder, for all your inquiries or assistance with retirement homes, senior residences, or downsizing, be my pleasure to help. Our services are completely free. Call me at Lianas Senior Transition Support, 514-622-8074, or lianasservices.com. Many thanks to our technical producer, Jimmy G. Great job again, and you could listen to Life on Rehearsed here on CJD 800 every Saturday at 3 p.m.